recording.
And Paige, what I'm going to do is I'm going to go ahead and share my screen now. So because I've got to do a couple of steps to get this presented on the right screen. So is that cool?
Oh yeah, yep, go ahead and I'll start
Oh,
introductions.
I don't have capability. You have to give me.
Let me. How about now?
There we go.
Sounds good. So thank you everyone who are on the call today.
I'm sorry, I just got a couple more emails. People are waiting for passcodes.
Okay, the passcode is 1234. Yep, I sent it out again, who was on the email invite update a few minutes ago. So we'll get started though, and I'll check my email too to make sure to send that passcode over. But thank you all for joining us today. We're excited to have you on here. I know there's been discussion in the past about MA apprenticeship. A lot of organizations are facing, shortages when it comes to medical assistants. So the Michigan Center for Rural Health is excited to host this opportunity to discuss a little bit more about possibly in-house apprenticeships for your organization. So we have John Cluess from CareerStep. He's going to offer some information on how CareerStep could help your organization with medical assistant education. CareerStep is an e-learning platform designed for various comprehensive healthcare training programs, but we're going to kind of focus on medical assistance today. But CareerStep has been around for over 25 years and has helped many health partners fill those dire workforce positions, such as medical assistants. And that e-learning platform allows virtual learning from anywhere and allows flexibility to have your own apprenticeship program within your organization. And then Stacy Fitzpatrick from My Michigan Sault Ste. Marie is going to also then be after John, and she'll discuss how CareerStep has helped her in-house medical assistant apprenticeship program and kind of the process for creating their internal model of the apprenticeship. So without further ado, John, do you want to start?
Yeah, thank you, Paige. I appreciate the opportunity, everybody. I'm looking forward to this presentation. I'm going to go through these slides pretty quick and then hand it over to the most important person, which is Stacy, who's been a partner of ours for several years now and has been a huge proponent and champion for providing career pathways and ladders for allied healthcare staff across My Michigan. And so a quick introduction, I'm John Claywise. I'm the National Director of Healthcare Employer Partnerships. And then with me today is Stacy Fitzpatrick, who's the Director of Outpatient Clinics for the new My Michigan Health. And so with that, I'm going to jump in, just go over a little bit about who we are. So CareerStep, so it's our mission to make training in allied healthcare accessible, efficient, and also effective and affordable. I think we should add that portion into the slide. And so we are a 100% online training platform for those folks and that are interested in getting into a healthcare profession or prepare for their first jobs, or in the case of our partnerships, prepare them to become more effective in their skills and competencies in their existing organization and provide those career ladders and opportunities for advancement. So what do? So we provide high quality workforce training solutions for healthcare employers. That's just one avenue of what we do. We have several other divisions and organizations under our brand, but really just kind of the high level is our goal is to improve employee performance. So we build our programs to provide those certification level programs for somebody who might not have a certification as a medical assistant, dental assistant, pharmacy tech, medical coding and billing. They've been in the business for a while, but there's an opportunity for them to upskill and gain those skills to get certified. We provide standardized training for those individuals to provide that opportunity. And our goal really is to develop a really high-level skilled workforce for specific roles in an organization. So we're kind of trying to address those gaps in the allied healthcare, I want to say industry, because if you look at healthcare as an industry, I think our latest report and analysis said that 66% of the healthcare workforce is comprised of allied healthcare professionals. So it's those non-degree professionals that are focusing on like MAs, dental assistants, pharmacy technicians, medical coding and billing. And so that's kind of where we play a huge role, is to make sure that your organization has highly trained and skilled allied healthcare professionals. In addition to that, all of our programs meet the national certification level standards. So we've been approved by the third-party accreditation and certification bodies out there for our programs. And so really it's career training that builds your employee skills over that framework. So our framework goes into quality, convenience, and service. So we provide high quality content that meets all the national and state certification requirements. And the instructional design is geared towards folks that we know allied healthcare professionals, any healthcare professional is very taxed, they're stressed, they're working a lot of hours. And so we try to make it as convenient as possible. So our programs are 100% online, they're self-paced, asynchronous. And then from a partner perspective and also a learner perspective, we provide real-time reporting on the progress and where each learner is in the program as they're going through it. One of the things that I really love about CareerStep when we partner with a healthcare organization is kind of that service level. Every partner is assigned a dedicated partner success manager, and that person is responsible for working very closely with your organization to get your staff enrolled into the various programs, the timing, all that stuff. They also meet on a regular basis with the leaders of your organization to get those reports. So we want to make sure that we're providing real-time reports out on the progress of your learners, so we can mitigate any issues if you have staff that might be struggling, or if they are not getting through the program. We can mitigate those issues right up front through the use of our partner success managers. All of our instructors are in the business and certified. So if you look at community colleges and online universities, the folks that are teaching the programs and courses are all in the business, and they've been in the business for a long time. So they're certified, and they've gone through the training program to teach our curriculum. The other cool thing is every learner, whether it's a person coming off through our B2C motion or business to consumer motion that just wants to get enrolled in a program, or from a partner, healthcare partner, we provide advocate services. So it's kind of one of those areas where each learner is provided somebody that's going to be with them throughout the life of their program as they're going through it. And so those advocates can help get access to instructors, tutoring, tech support, online communities. And so I really love that. So when you partner with CareerStep, you're just not paying money to enroll in a program and that's it. You get a staff, you get a team basically from CareerStep that's going to help make sure that we're doing all that we can to ensure success for each learner. So skills-based learning. So we've developed our curriculum to run from the necessary skills to distinguished. And so the distinguished portion of this is what sets those folks apart from their peers and other candidates they're trying to get into the market. So we provide training that's going to get those folks the necessary skills relevant for the job. And then we're going to take them through the program to define their day-to-day tasks and responsibilities. So those skills that are required to perform great job duties and understand not only the technical skills, but we also go through the soft skills training that are required to be a professional healthcare employee. And then the really cool thing about our career pathways is that we offer advanced skills. So I'll give an example of somebody that gets enrolled into our medical coding and billing. program. Let's say that they really have a desire to do OBGYN coding or emergency department coding or HSS. We provide courses and certification level programs that somebody can get into that program and then really start focusing on where they really want to go with their career. So I really think that's cool. We take a person from the very basics all the way to they can be really skilled and defined and distinguished in a certain aspect of allied health. And so our methodology is pretty simple. We align the curriculum to make sure that your staff is ready for their career, and we support those skills and the knowledge for them to get certified. Our development, we've really taken a lot of time and effort over the past 5-10 years to develop a curriculum that is flexible, that meets the standards of all of our third-party certification and accreditation bodies. And it's cool because a learner can self-serve. So they can log in 24/7, 365 to learn that program at their pace. And number 3 is assessment. So as a person's going through, or an organization wants to kind of assess where their staff are in their various jobs, we can build, or we have built, very meaningful assessment tools to where you can see where your staff currently lie within the expertise realm, and then provide really kind of single course or micro learning areas to where they can really focus on their deficiencies and get better. And then all of our programs are really focused on the engagement. So it's not just reading an online textbook and, they're just kind of reading this book and, skipping through pages. There's activities, there's interactions, there's case studies, there's simulations. We have lab kits for some of our programs. And so we're really trying to drive home the understanding and retention on each course and module that a person goes through. And this is just kind of standard through the learner journey as somebody gets enrolled in our program. We get them enrolled, we onboard them, they go through the training. If it's a program that requires an externship component, what's really cool about it is that they can satisfy those externship hours kind of baked into the training as they're going through the program and satisfying their day-to-day role, as well as the training aspect of the program. And then we prepare them for the certification. So the one thing that I really love too is that when a person enrolls in our program, including in the cost of the program, we provide the vouchers. So when you're talking about a medical assistant, the curriculum prepares that person to sit for 4 different certification exams, and we provide the vouchers to sit. So it's the CMA, the CMAA, which is Certified Medical Administrative Assistant, the Certified EKG Technician, and the Certified Phlebotomy Technician. So if you decide to partner with us, every staff member that enrolls in that program will have the opportunity to sit for those 4 exams if they want to. And then we provide them for that career advancement, in which on this next slide, this is just a snapshot of some of our most popular programs for enrollment. But we have 70 plus different programs, and that encompasses over 300 courses. And so we're very comprehensive. And Paige, I will share out to you, and you can pass this along. You can go to our website, careerstep.com/programs at the bottom. But we have a spreadsheet. It's an Excel tracker with live links, where if you are interested in seeing mental health professionals, you just click on the link and it takes you right to that page. So you don't have to navigate through the entire website. So I'll send that out to you, and then you can pass that along to everybody as well. This screen just shows our third-party certification and accreditation partners that we have. And so these folks audit and accredit and certify that our curriculum meets the national standards for every learner that's going through the program to sit for that certification. And so they push down new codes, new information, new technology, whatever it might be to us on, I think there are some programs that's almost on a daily, especially when we talk about medical coding and billing. And so we are continuously working with these third-party certification and accreditation partners to ensure that we meet their standards, which I can answer any questions about that later. And then this is a very busy screen, but it just kind of showcases, showing off a little bit some of our partners. So Michigan Primary Care, Pennsylvania Association of Community Health Centers. So we're partnered with a lot of this, what we call state level associations that are really trying to focus on what their rural health clinics and hospitals can do to retain staff in this environment, because it's tough. It doesn't matter if you're the Humana's or, as we look down here, CVS, Walgreens, Walmart, Albertsons. It doesn't matter the size of the organization. Every company is struggling with what they're going to do to retain their new and existing staff, and then also provide those opportunities for career advancement. And so I like to show this very busy screen a little bit on some of our marquee partners. And then this is just kind of going over our content. Like I said, we update our courses all the time. Our instructors are experts that are in the business, and we try to make our curriculum as easy to use in that design aspect to where it's simple to use. So if you have internet connectivity, a tablet, a PC, laptop, whatever it might be, you can access our curriculum at any time you want and then do your learning. And then this is kind of on the right, you kind of see a snapshot of the dashboard. So it's all kind of app centric, if you will. So somebody can just click on any of these boxes on the right and go through the curriculum in order. So, and then it's convenient. It's like I said, it's 24/7, 365. So it's at the pace of the learner and how they want to learn. So we make sure that it's convenient for them. So it's convenient for the staff or anybody that wants to get involved in allied healthcare, that they can do it at their own pace. And then the customer service I kind of alluded to, but the partner success managers, as Stacy knows, she's worked with us for a long time. The partner success manager, we call PSM, is really integral into the success of the partnership. And what we want to do as a partner of yours is to really kind of take all the friction or stress of getting your staff enrolled into a program and really just kind of take it over, right? And make sure that we're doing all that we can as a partner to ensure success of your staff and the overall partnership. And then finally, we don't really market this out very well, I don't think, but we have great online communities by program. So medical assistants, dental assistant, pharmacy, each of these programs have a community where they can go in, get help. They can network with other MAs, DAs, whatever it might be, that are in the program across the world, and just kind of get into a community of other folks that are going through the same situation and scenarios. And it's really cool to have people go in and network a little bit. And then with that, I got your picture up there, Stacy. I just pulled it from LinkedIn, but I added this little slide. And then from that aspect, I'm going to turn it over to you and just kind of have you talk about the partnership. And I know that's kind of the most important piece of this.
Do we want questions first, or just have me go right into it?
I guess, is there any questions for John before Stacy starts? Can either unmute yourself or put it in the chat as well. Anyone has any questions yet?
I have a quick question.
Yeah.
You said it was self-paced, so does that mean like they have forever to do it, or would that be like within a year, or?
I teed you up on that, so that's good. No, so most of our programs we give a year to finish. There's some of the kind of smaller certification level programs that are like 6 months or less, but like with medical assistant, dental, pharmacy, medical coding and billing, like the big ones that are really extensive, we give a year for somebody to finish. I will tell you, and Stacey will tell you this too, is most, if not all of our healthcare partners across the country are allowing their staff to spend a certain amount of their regular workday to do training in a lab or, in an office to where they're just focused on 2-4 hours or whatever it might be of the curriculum and then spending the other rest of their day kind of doing the on-the-job training or shadowing a preceptor or their manager to kind of, like I said, bake in that clinical externship component. But yeah, so most of our programs are a year. Most of our partners require that their staff finish way less than that because they're allowing them to spend a big portion of their work day, and they're investing in that too, to do the program, right? And so, but that's a great question.
Thank you.
All set? So yep, I'm Stacy Fitzpatrick. I'm the Director of Outpatient Clinics here at My Michigan Medical Center, SUE. We started our partnership with Career Step back around 2019. At that moment, we were told by our administration that we were getting 4 to 5 new providers in a matter of 6 months. We were going to be onboarding them. And of course, we went into panic mode because we just did not have the staff. We had no applicants. We do have a university here. It no longer has an LPM program to feed us. It no longer, or it never did have an MA program. So we were really kind of getting desperate for staff. It just kind of fell in my lap one day. I had a student of Career Step who was an individual student contact me looking for a placement to do some externship hours. And I spent a great deal of time talking with her, learning about the program, how she learned about the program. And then I started discussing it with my co-director at the time and said, you know, I think this is something that we could present to administration to see if we can make a go of this. So all the information I had initially was just
MA pipeline.
yeah. All I had initially was just getting I went on the website, got their fee, of course, which is a much higher fee than what we were able to negotiate when we entered into our partnership. We talked about how long we thought it would take. At our organization, we hired MAs that were uncertified. And with that, they had restrictions on what they could do in our system, as far as they couldn't do med reconciliation, they couldn't process orders, couldn't do medication refills. So we would hire them. And at the time they were given 30 months to learn on the job and then had to take a certification exam within those 30 months. Because what we learned is that if somebody did not have formal education, they could challenge the test at 24 months of on-the-job training. So that's what we started with, but it really wasn't successful for us because we were losing people at that 30-month mark because at that point they didn't want to take the exam. So we moved into the process, started making calls, Career Step, started chatting with another one of John's co-workers there, set up our plan. And what we found is that we originally, when we started the process, we had it set in our minds that we were going to set it up kind of like a classroom and have a group of people come in and do classroom type thing. So we started with 8 people all at once. We found very quickly in that process that it just wasn't going to work the next time around for various reasons. People were learning at different paces. We had some people that maybe had some senior experience in the past and they were whipping through the modules. So in essence, we were kind of slowing them down while others with absolutely no healthcare experience were taking a little longer. So we took that feedback. We also talked to our first group about the modules and how they felt things were going. And one thing that we were able to do in our partnership is we're able to really reach out to Career Step and tell them what it is that we're needing, what we're finding, that if they could help us you know, what the first class reported is that it's just so much reading. So we went back to Career Step and said, you know, is there any way to get an audio version for this coursework too? Because sometimes when somebody's sitting in a computer lab for several hours, it becomes difficult for them to learn, and to be able to have that audio version once in a while. Some people receive information differently when it's in a lecture type format. We found that they went right to it. So our very next class that we started, or the next group of people that we hired, they found a new platform for us that had the same content, that offered that audio version, and that was a big pleaser for our students. The other thing that we did is they do have access to the program for a year. We have put it in their contract that they have to take their certification within 1 year. When we started this, at the time, we were offering retention bonuses and recruitment bonuses to staff, and that was kind of our sell to admin. We went to them and said, you know, we're offering this anyway. Is there any way that we can pay for people, pay their education as their recruitment bonus, pay them to do it here at work? It's actually going to be probably a little less in the long run for us. And thankfully for us, admin allowed us to move forward. We went along with it. We've been very successful. We have to this point signed up 30 since 2021. We've had 32 MA apprentice enrolled, and at this point we're at a 70% retention. Some people left due to moving out of the area, relocating. We have had a couple people leave to different entities where they could make a little more money. And we've had a couple people that just really probably weren't suited for this role, and actually they've been absorbed in other areas within the hospital. The other thing to mention is that the content is very, as John said, in line with the requirements for certification nationally. We have had a 99% pass rate on the first attempt of their exam, which is fabulous. We've only had one that didn't pass it the first time, and she passed it the second time. And she is also one that is no longer in our department. She has relocated to a different department in the hospital. So, you know, she may have struggled anyway. So we've been very, very pleased with it. The one thing that when we presented it to admin, it really wasn't going to be, other than that upfront cost associated with getting their education paid for, there wasn't a whole lot of extra cost absorbed. We didn't need to hire a teacher to teach the course. All of the education, the true education, and all of the troubleshooting and questions that the learners might have, that is all handled by Career Step. They have, like John said, they have instructors that they can reach out to, ask questions for clarification. So the actual formal training in those modules was not anything that we needed to be concerned about utilizing our resources for in that moment. We were already low on resources, so that was a plus for us. The other thing is that we do have a computer lab, and fortunately that lab was put in place when we were going through an EMR project. So we didn't have to buy any new computers or equipment to get this started. We had access to those things. We created a classroom where the learners come in, they spend 50% of their time in the computer lab and 50% of their time out doing hands-on learning. With that, we pay for the cost, and we did negotiate a course fee, which Career Step has been great to work with there. And so we have them sign an agreement when they enter into full-time employment that they have to make a 2-year commitment. If they should leave prior to 2 years, or if we find that we have to end the relationship with them, it's their responsibility to pay back the cost of the education. we found that most of our people are completing their modules within 6 months. And that's on the high end, for those people that really haven't had a whole lot of experience prior. For people with a little bit of experience in healthcare, they're completing the modules fairly quickly. The other thing is that they're assigned to a preceptor, and within the clinics, the preceptors are incentivized right now. They get a little extra incentive to become a preceptor, and to agree to take on students, because sometimes it can just be overwhelming when you're consistently training one after the other. We found that in the last year, for sure, our providers have become really engaged and are taking opportunities for training and teaching. They understand the need that we have, and they're becoming very invested in it. The other thing that I will mention is that we utilize our own resources for the hands-on training, and they would be taught any kind of a skills checklist and would have to have that checklist just like any other new hire would. That's how we check them off on their skills. So it's really kind of no different for us from when we hired non-certified, except that we know that in the end, there's going to be a certification coming soon. So that's kind of the plus on our side. Any questions?
Stacy, one
Stacey,
question.
I'll add, we have a lot of partners across the country that are looking to invest in their staff and in the career pathways. And just kind of lessons learned. I've been with the organization almost 2 years now, and some of our partners that were just testing the waters with, providing these programs for their staff is, they would invest the dollars to get their folks staff or trained, and then they would leave. Like they would literally get the training over the year, and they get the certification under their belt, and then it's like, see ya, I'm off to a bigger system. We, obviously we can't tell companies how to run their business, but we highly suggest that if you do move forward with this type of situation and opportunity, is like Stacy and what My Michigan Health is you do put in an employment agreement. The interesting thing, because I've had an opportunity to interview staff that have gone through the program, that are going through, and so one of my questions is, first of all, how do you feel about getting the opportunity? And there's been a couple folks that have started crying, like, they're like, well, first of all, I've been here for 10 years. I didn't even know the company knew my name. I was just a number. I just do my thing. And then I was never offered any opportunity. And this is amazing. I just, elated how it's going to help impact my family and me professionally. And then the other question I always ask is like, well, what did you feel about making, or signing an agreement to stay a year or two after? And every single person that I've interviewed is like, I don't want to leave now. Like the company is providing this opportunity for me, so I'm not going to leave. That's the whole thing why I was like even thinking about leaving in the first place, was I felt like I've been an admin assistant or a non-certified MA for years and years, and there was just never any opportunity for growth. And so I was looking externally for that opportunity. And it's really refreshing to hear some of the responses, like now that they're provided the opportunity, they have no problem signing a year agreement or a 2-year agreement. And because they're not going to leave, like they said, like 70% retention rate is about 60% higher than some of our partners were experiencing before they started investing in their staff. So the retention aspect is just an amazing thing. 70%, if you look at nationwide in any position or any career, 70% retention rate in this day and age is exceptional. And so that's just a testament to not only the training, but an organization offering and really taking that step to invest in their staff. And it's always, even in 2023, it's oftentimes I have conversations with CEOs of health systems and hospitals, and that whole career pathway and investment in talent is still it's a something that they're not thinking about, right? And so anyway, that's kind of my 2 cents on that. It's really important to provide. We have another presentation that has stats from BLS and Becker that show that it's like 70% of healthcare workers are looking at opportunities over cash, right? So they're looking at career opportunities and advancement over just a dollar amount, which you might think is weird at this day and age, but it's not. Like, people want opportunities to do something more, something greater. And with allied healthcare, you got to think that those folks are the folks that typically don't have a 2-year degree or higher. And so for them, getting a certification or 2 under their belt is just like getting paper on a degree, right? And so it's a really important aspect. Super passionate about that. I've been in education a long time, and so just I'm really excited to kind of see what your thoughts are. Stacy's been wonderful. My Michigan Health has been an amazing partner. They were, even prior to me coming on board here, they were kind of had the forethought and forward thinking of, let's do something to retain our staff. And we have partners like Humana, HCA, Tenet Health. And when I talk to the executives at those massive organizations, training is still a novel thing for allied healthcare staff. It's a weird conversation, and it's something I'm thinking it should be a natural conversation to have. But Stacy's organization has been wonderful. They've always been kind of ahead of the game on that kind of train to retain mantra, which we kind of put in motion. So with that, I'm going to shut up now, and if there's any questions, we'll field those. We have, I think, 20 minutes left.
And there's one thing that I will add to that with John talking about investing. When we first presented this to our administration, we
lost your sound, Stacy.
Sorry about that. One thing I'll add for John is that when we first started this, when we presented it to administration, our initial thoughts were, well, let's bring them on as contingent employees, and then we can reward them once they get their certification and put them on as full-time employees. And that was our initial thought, because, we're not going to be out the benefits. We're not going to be out all of this cost if we don't, if they don't make it, if the program isn't for them. We would only be out the cost of the education essentially until they paid it back. But what we found is that we just weren't getting applicants. And John is right. People are looking for long, full-time employment with benefits. And the minute that we got permission to just say, can we just bring them on as a full-time employee from day one? Those are the only applicants we get nowadays. It's very rare that I will get an applicant for an LPN or for an actual certified MA for organizations. So we appreciate that our administration hearing us, and I don't know, Kevin Kelchuk is on the line and he was part of that process, so maybe he might have some input, but we were really, really in a panic mode when we just kept adding providers and did not have support. So we were so thankful that our administration heard us and was willing to work with us.
This is Kevin and Stacy. I absolutely agree with you. And again, people don't have the time with their busy lives, their family, their kids, they're working to support them. How can they take the time to go through training contingently and give up that income? And so we really felt that was important to get them on board and show our support right away.
That's great. I mean, that makes a huge impact. I think there's another piece to this that's a huge, powerful thing for organizations that are, especially in rural America, that are struggling to find talent, because we've also, CareerStep has this whole academic partner side of the house that partners with Division I, II universities, as well as community colleges, and to offer our allied healthcare programs as an online component, because they simply, and this is a quote from several, they can't get butts in seats for their allied healthcare programs. So guess what? They're dropping them, right? And so from from a talent pool or talent pipeline, a lot of what we're seeing in rural America is there's no pipeline, right? So what do we have to do? We have to create new and interesting ways to interest talent. And I think an aspect that My Michigan is doing really well is using this training program as a recruiting tool, as part of their job description and part of the interview process is, saying, listen, if you are interested in becoming a certified medical assistant, we're going to, day one, as soon as you're on board and go through all that process, we're going to provide and pay for you to be trained to get certified. That is huge in today's market, where people are, they're looking at opportunities for growth and to support their family, like Kevin said. And so I think another aspect of this is what you're all doing great too, is using this as a recruiting tool. Like, if you're willing to invest in talent and you put that out there, that you're going to have the option and opportunity to get certified very quickly through the onboarding process, you're going to see those folks, you're going to see more people coming in on resumes, because we know for a fact, especially in Michigan, a lot of their community colleges are just simply dropping their programs, right? And so we got to figure out ways to acquire new talent. And so I think using this type of opportunity in the market and the community is huge. So.
Well, thank you, John and Stacy. Are there any questions? If anyone wants to unmute or can put it in the chat. We have 15 minutes left.
Yeah, hi, I have a question. My name is Tara. My question is, the students, they have their curriculum that they're following. Do we share that then with their mentor, so that whatever they're learning is what they're going to be doing on the floor, and that mentor knows, we're showing them vital signs, we're showing them how to measure a baby, like where they are in their learning path?
Yeah. So we provide, it's called externship checklist, and it's actually a document, right, that each person has. And as they're going through the modules and the courses in the program, they have a checklist. And as they're shadowing or working with a preceptor, they have to get that. There's two check boxes. It's one for the learner and one for the mentor or preceptor to check off, saying, yes, John satisfied the requirements. He's done 10 sticks successfully and hit the capillaries and veins every single time. And so check that off the box, and then at the end of the program, those boxes have to be checked off and also signed by their mentor, preceptor, and boss, or whatever it might be. So we give them the vouchers, right? So we make sure that we're doing that to ensure that not only is the learner going through that coursework and those, in-person activities, but also somebody that's in the role as their mentor or preceptor is checking that box and certifying, if you will, that John satisfied those requirements and would attest to that in order for us to give them that certification voucher.
Any other questions for John or Stacy? And Stacy, too, just a question. Was there any, I guess, discussion or have to do policy changes, internally with the start of this apprenticeship, like any discussions, I guess, with the HR department or any other, I know you mentioned admin when you brought it to them, but just any other, discussions of any policy changes that might have needed to occur?
Yeah, there weren't. The biggest thing was getting a employee contract in place for the applicants for their payback portion. We did have to go to the clinical nursing group to discuss a policy regarding MA apprentice being able to accept orders, verbal orders, things like that. And we were able to get approval for that as long as they were working under their preceptor as part of their training and learning process.
Mm-hmm.
So there wasn't really any big discussion about any policy changes in reference to this. I think because it just seemed to fall in line with our already, we already were hiring non-certified MAs just to get them in the door and training them on the job. And this just kind of fell in line with that. So there really wasn't anything extra there that we needed to do. The other thing I think is worth mentioning is through our partnership with Career Step. I probably have been their biggest cheerleader and also their biggest pain in the behind, because we have to get creative and think outside the box at times with how we're going to get, as John said, seats in the chair or get people to be doing medical assistant work. We need to have staff here to be able to provide the services in our community. And so one of the things that we did is we looked at an exercise science major position. Typically we would use that realm in like our cardiac rehab department, things like that. Well, we have a great program here at our university, and we were finding that the rehab department was getting a ton of applications with very little openings. And so we started thinking through, is there any way that we could utilize these exercise science majors in some of our clinics to help us out? So we ended up getting approval to post an exercise science / MA position. These were bachelor's trained people that had had all the anatomy and physiology. The only thing that was missing from their training was pharmacology class. They did not have a college pharmacology class in their training. So what I did is I reached out to John and Andrea, my go-to, and said, what does this look like if we were to be able to just use just the pharmacy module out of the MA program? Would it be possible for us just to pull that out to be able to set our ES, as we call them, up to at least have a formal pharmacy education, which all of our MAs would be receiving the same formal education? They worked with us. They gave us some pricing, great pricing on that one module. We're also in the process right now of separating the EKG module out for our the director of cardiopulmonary department is hiring off the street on the job training EKG techs. She's looking for some formal training for them because they also have a limited amount of time before they have to take on the job training before they can take their certification. And so we're currently in the process of working with them to be able to pull that module out. So there's lots of things that if you're going to think outside the box, they've really worked well with us and have helped us kind of bring a lot of these ideas to fruition. So it's helped us for sure.
I appreciate you bringing that up because that's kind of a deeper conversation that we usually go through. But let's say go back 5 years ago, our programs are all or nothing, right? So if you want to become an MA, you got to take every single module, every single course, and go through the entire program. We brought in 2019, I believe it was, a curriculum team that basically what we call Legoized our curriculum, because we had, much like Stacey said, their organization, they wanted pieces of programs, but prior to 2019, they had to purchase the whole program. So we brought in this crackpot curriculum team who basically worked on Legoizing all of our curriculum. So if you look at our 70+ programs, 300+ courses in that, we can I don't want to say customize, but we can tailor a custom training program like we're doing with My Michigan for that pharmacy piece, the EKG piece. We have folks that are wanting just ESS coding or OBGYN coding. That's part of like the overall major certification level program. But organizations want to piece that out in some cases where they have already skilled talent, but they just need to learn a little bit something new. And it's not a certification level full program. So we're going down the path in a different conversation with folks that are interested of that micro credentialing or micro training or micro learning. And so that's another thing. Stacy, they're forward thinking is there. Stacy did come even prior to me coming here. Was like, hey, can we take this module and just separate that from the MA training? And they just came to us last week and said, can we take the EKG thing and just parse that out to do a thing with our staff? So we do have that capability. And again, that's for another day and time. But I think it's important to know because there's a lot of training providers out there, but most that I know of are all or nothing training programs. With us, you can literally piecemeal out, specific micro learning across a spectrum to get your staff where you need them to be for their day-to-day role. So that's really cool. I appreciate you doing that. I didn't even have to tee you up on that one, Stacy, but that was really cool. Yeah, we do have that capability. So
Great, thank you. Any other questions for John and Stacy?
hey, do y'all have, did you Paige, did you provide our contact information, email, phone number? Just, I know we didn't put that into the presentation, but I don't know if Stacy felt comfortable with it, but I want to make sure everybody has my information if they want to reach out.
I can send it when I send the recording, if that sounds good.
Yeah,
And I'll send both of yours contact information if you would like. And yeah, we'll send out, for those still on the call, we'll send out the slides too that John provided along with this recording, and then to a survey too to see level of interest as well, because us at the Michigan Center for Rural Health would love to see these type of apprenticeship programs in your organization, but just kind of want to gauge what level of interest there is and have further discussions in the future here for 2023. But that was, I should be sending out, if I don't by the end of the day today, early tomorrow morning, to send out to all of you. But if there are no other questions, I will stop recording. And thank you, John and Stacy, for presenting today. That it was great information.
No, thank you. I appreciate the opportunity and look forward to having some further conversations with the folks that are on the call.
Yes.
Thank you, and we'll see you in a few weeks.
We'll see. Yeah, we'll see.
Yes.
Then, we're going to be there. So I'll be
Yes.
there with in my suit and tie and meet everybody there at my little booth that I'm setting up. So
Yes, John and Stacy will be at our annual health conference. That's April 27th through the 28th. So for those who are on the call still attending, they will also be there. So if you have questions, want to meet them in person, they will be attending.
Yep.
Thank you, everyone.
All right. Thanks, everybody. Have a good day.
Thank you.